very important to understand that the fundamental mission of the drug industry is to maximize the financial returns to the investors and shareholders. And while they do that, to appear to be ethical. Over the past 30 years, there's been a radical transformation in the way that knowledge is created in American medicine. And I'm not just talking about advertising and public relations efforts. The articles that appear in our most trusted journals, now 2/3 to 3/4 of the clinical trials that appear in our most trusted journals are commercially sponsored. And we know that commercially sponsored articles, the odds are 5 times greater that commercially sponsored articles will conclude that the sponsor's drug is the treatment of choice compared to non-commercially sponsored studies of exactly the same drugs. So with this radical privatization of our medical knowledge, what we get is the knowledge, the evidence that drives our medical care grows in a direction towards corporate profits the way that plants grow towards sunlight. And the problems are twofold. Number one is the mechanisms of oversight of the integrity of this corporate-sponsored knowledge have been infiltrated by the drug industry itself, so that the FDA and the universities and the researchers and the medical journals are all dependent upon drug company money. But the really important problem is that our knowledge is growing away from an epidemiologically balanced approach to healthcare. So now the United States, the wealthiest country in the world, is spending twice as much as the average of the other 21 wealthiest countries on healthcare, and Americans live 2.5 years less in good health than the average of the citizens of the other 21 countries. We've got an unacceptable situation where we approach problems in the most lucrative ways, but not the most effective ways. And one good example would be that we think that we're preventing heart disease in women and people over 65 who don't have diabetes or heart disease by giving them statins and lowering their cholesterol. And there is not, despite the guidelines, there is not a single randomized controlled trial that shows that statins are beneficial for women or people over 65 who don't have heart disease. Yet we're spending billions of dollars on these drugs, and we're wasting the opportunity for doctors and patients to work together for better health. That's what's going on in the United States. And then the really bad news is that we're exporting this high-cost, low-effectiveness healthcare to less developed countries. And what we're doing is sucking away their precious resources that they could be devoting to public health efforts to pay for the American approach to healthcare, which is based on the most lucrative solution, not the most effective solution.
2002, Safety Net became aware of the proposed biolab 4 on Albany Street by BU. At this point, we began the investigation as to how this came about. We approached all the powers that be, which means we approached PRA, Boston City Mayor, and we found out that there was some inequities in terms of how the whole package came about. We found out that NIH had given BU monies, in which BU had to then add a certain amount of monies. But none of this money went into needs assessment of the community involvement, information to the community about the impact of the biolab 4. Now, take into consideration that this biolab 4 will be dealing with the most dangerous pathogens that exist. Their reasoning is that they need to be studied in the case of an emergency. What case of emergency will be that they will be causing them. When the anthrax situation hit the States, there was a whole lot of commotion. And I'm concerned that they're willing to put my community, which includes the South End, at risk for not only anthrax, Ebola, and others. Now, we have had some success at the state level, and our case has been taken up by the Supreme Court. We also have a case against the federal court. I'm one of those plaintiffs. One of the things that I want to bring into consideration is that there have been some scares of tularemia already 3 times occurred in the Albany area. That's not the Bio4 lab, it's the BioBreeze. At the beginning, they kept that a secret. They did not inform the community. Okay, the Board of Health should not take the proper avenues to work along that line. The most recent one was a couple of my granddaughter were caught 2 blocks away by gridlock. God forbid if there had been a real, true emergency and outbreak, I would have lost members of my family. But not only that, I would have lost neighbors, I would have lost friends, I would have lost my own life. I want you to understand that in the worst case scenario, there has been no preparation, there has been no consideration with seeking an alternate site. There has been no consideration as to how these chemicals and pathogens will be transported through the city. And as I say, I'm very much concerned about the next generation. I'm going to make a statement here that may sound harsh, but at 9/11 we were concerned about the terrorists from outside the United States. Now I'm concerned about the United States bringing in biotech terrorism to my back door by the BU's research.